Who are the best candidates for breast augmentation? Usually people who are suffering from small breast volume as compared to their body profile. They often lack confidence because of inadequate volume in the breast. They are the best candidate for breast augmentation. But breast augmentation can also be done for various reasons. People who are suffering from some kind of deformity or abnormal shape of the breast, and one of its kind is called tuberous breast. Or if there is asymmetry, difference in the size and shape of the breast. So breast augmentation can be done to improve the size, symmetry and shape. The most important thing selecting breast implant for augmentation includes: 1. What size is appropriate for a particular body? And when you determine a size, it's not only about what it looks like now, but what it is going to look in next 5, 10, 15 or even 20 years. The second important thing about breast implant is, where do we place the implant? Does it go inside the breast? No, it does not. Does it go behind the breast? Yes, it goes behind the breast. But behind the breast, it can be either in front of the muscle or behind the muscle. Breast implant behind the muscles are specifically used for people who have very thin breast tissue and very thin skin. Because we are worried if you put the implant in front of the muscle, it may look artificial, unnatural, and over a period of time, it makes the skin even further thin, and that does not look very good. So for a long-term better outcome, it needs to go behind the muscle. It's very important to understand that it's not all behind the muscle. It is half under the muscle and half under the tissue. That's called dual plane, and that actually gives a more natural and long-term outcome. However, behind the muscle is not a good option if there is a lot of laxity in the breast tissue or sagging in the breast tissue. Imagine the implant is behind the muscle and the patient or the person moves or stoops forward and the breast falls away from the muscle. It doesn't look natural. Now, breast implant in front of the muscle is a good option for people who are having some breast volume, have good amount of fat tissue covering the breast area, they're a bit of chubby, they are good candidate for above the muscle implant. It's called subfacial. It has many advantages. One is it does give a very natural look, it gives a natural feel, and it stays natural for a long period of time. Now, what happens after breast augmentation with implant? So, what to expect after breast augmentation? Usually, there is a healing period after breast augmentation. The first 1 week, it does not look perfectly all right. It does look a bit firm, it does look swollen, and it takes a little while for body to accommodate the implant. Over a period of time, it softens up and feels more natural. Now, it's very important to choose the right size of implant. Most of the time, people like to have bigger implant for a bigger breast, but it's very important that the implant is selected based on medical need of the person. The key is to have an implant size which is slightly smaller than the actual base diameter of the breast. If you follow this system, the results are better and it stays good for long term. The moment you try to cross this limit, making a bigger pocket, using a bigger implant which goes out of the boundary of the natural breast, then it is bound to give problem in future. Scientifically, it is proven that any implant that is less than 350 cc tends to stay good and natural in long term, and often these people do not require multiple surgeries in the future. But when the size increases beyond 350 cc, the risks increases proportionately. If you want to know more about breast implants, how it works, whether it's appropriate for you or not, don't hesitate to contact me. I'm very happy to answer you all your questions.